All right. Good morning, everybody. Thanks for joining us for Design at Your Desk, the 10th training in this health literacy series with Health Literacy Media in Kansas City Health Department. I am going to share the screen here. Right, are people seeing the full screen slide? No, okay, I need to switch it, thank you. All right. Thank you very much. All right, well, I'll just introduce myself quickly. My name's Chris Casey. I'm a manager here at HLM, and I've also been working on some of the Kansas City Health Department creative materials here on this project with you all. However, this is the first time I've been able to reach folks on training, so pleased to meet you all. This is, as I said, this is Design at Your Desk. We're going to be talking about how we use health literacy and design best practices to create content. Perhaps many of you have seen some of the creative materials that our two organizations have been working on together. Some of the fruits of our labor. Well, here, I'll pop over to the slide. So this is my face and my name again. I'll just introduce myself a tiny bit more. So my training and my background are actually in sort of an interesting combination of fine art and public health. So I have a Bachelor of Fine Art degree, and I also have a Master of Public Health in Behavioral Science and Health Education. And I say that to introduce myself, but also to share that we really do see health literacy as a combination of art and science here at HLM. So we have kind of the creativity side with the evidence-based science side coming together. And so I'm also joined, her face isn't on this slide, but I'm also joined by my colleague, Megan Rooney. You may see her on the Brady Bunch squares there. Megan's here to offer support and to monitor the chat and let people in and just be a general good friend. So Megan's gonna let folks in who may be arriving late and so on. So thank you, Megan. Okay, and so we know that many of you have probably been on trainings with HLM before, but just to review some of these sort of procedural pieces. So during the training, we really value your participation, your questions. Please don't feel like you're interrupting or anything like that. So feel free to unmute yourself if you have a question or a discussion point you'd like to contribute, some experiences you'd like to share. And if you don't wish to speak, feel free to use the chat. And as I said, Megan is going to keep track of that and bring up any questions that are coming up in the chat. And so then after the training, we're going to send you a summary and some resources that you can use hopefully right away in the work that you're doing every day in your communities. And then also before we hang up and move on with our respective days, we're going to ask that you fill out a very short post survey that just asks some questions about how the training went and suggestions for how to improve or other topics in the future and so on. So, any questions before we kind of just dive in? All right. Well, let's carry on. So here's what we're going to talk about today. The first item is health literacy and health literate design, kind of an introduction and an overview. We know you've seen and probably read and from other sources too, learned a lot about health literacy and why it matters. So we're not going to give a full health literacy 101, but we're going to talk about the sort of overlap between health literacy and design and why it matters. We're going to show you some, some practical tips for approaching designing creative materials in a health literate way. And I'll just quickly say that even if you won't necessarily be designing materials yourself, it's great if you will be, and hopefully this will be useful for you. But even if you're not, this may give you sort of a vocabulary and a way to think and talk about design. So if you're sort of consuming designed resources, or maybe you're on a team that's evaluating an existing design resources and giving critique and suggestions, hopefully this might help you with that kind of process as well. And then next we'll do a short live demo in a free online design app that we like to use. It's called Canva. Perhaps you've heard of it before. Just to kind of show some basics. It's not going to be a super deep dive. And then lastly, we hope to have some questions and discussion, and we'll share some resources. So let us carry on. And so what is health literacy? So we've talked in the past, hopefully with you all, about the many definitions of health literacy. Some focus on the individual, others focus on organizations. But what they all share is the idea of health information. And so when we're putting health information out into the world as organizations, how can it be made to be the best it can be for users? So here's one of the many definitions of health literacy that really fits well in the context of design and materials development. So I promise this is the only slide that I will read to you. That health literacy is using cross-disciplinary, evidence-based health communication best practices to guide both healthcare professionals and community members to use health information and make informed decisions about their own, their families, their communities, their nations, and the world's health and well-being. So wow, that's a lot. The world. One thing I want to unpack here, though, is the idea of cross-disciplinary. And that's really important. And so, here at HLM, when we approach materials development, we bring in perspectives from a really wide variety of different disciplines. So on our team, we have folks in health education, writers, things that you might think of, but also subject matter experts in medicine and health topics, social workers. Megan is a social worker, people who know how to fit health information into the context of people's lives and communities. We have a pharmacist and a trained chemistry person. And so, bringing all these disciplines to bear can really help health information be complete, correct, and actionable, and really fit into people's lives. And so, and then the other piece I wanted to unpack here is the idea of healthcare professionals. And so I'm going to get into that in one of the subsequent slides coming up here pretty soon. So when we think about health literacy, we have some guiding frameworks that we use. Two of them that are relevant for this topic right now. One of the two is plain language here. And so plain language is communication that your audience can understand the first time they read or hear or watch it. There's many ways that we can take in information. And so plain language is really a set of evidence-based tools and approaches for developing communication that make sure that those materials and messages are clear, but also that they're actionable and that they help people do what they need to do. So the emphasis with health literacy and plain language is on behavior and action, not just awareness or knowledge. And so that's one of our sort of fundamental principles that we start with. Another one here in this context is what we call universal precaution. So if there are any clinicians in the group here, or people who've been close to clinical practice, the idea of universal precautions from that area is that we put on our same personal protective equipment regardless of our subjective evaluation of a patient's infectious disease status, right? So you put your gloves on with every single patient, not just certain ones that you think you maybe need to put on gloves for, right? And so that's universal precautions. And we can apply that same principle in health communication. So we use plain language and other clear communication principles with everybody, written and verbal communication, because everyone can misunderstand complex information and everyone prefers easy to understand information. And so even if you're a highly educated person, you can be in a state of stress, which really lowers your ability to process and understand information at a high level, right? We like to talk about how health literacy is a state and not a trait. So it's not something that's just baked in and that's how you are. You have low health literacy or you have high health literacy. It can really change for an individual with circumstances. We've done audience testing with clinically oriented health communication messages, and even clinicians prefer plain language over really technical, jargon-filled, medical literature. Now, that clinician may go on to read the jargon-filled medical literature if they're interested, but for that first pass of information, everybody really prefers plain language. So that's universal precautions. And so the next sort of overall orienting piece we wanted to talk about is the influence of health literacy and the ways that we're exposed to information in our environment, right? And so we know that really everybody is vulnerable to misinformation, but especially people who have low health literacy. And health literacy really influences the level of information that a person can understand. And there's really a mismatch in skills between patients and what the health system requires of them. So most health information is not written or developed to support how people really learn. A lot of materials, health education materials, are written at a really high reading grade level, for example, 11th grade or even higher, which is far above the 5th to 7th grade reading level that the average US adult has in terms of sort of functional reading ability. And so health literacy is associated with where people get their information too. So people with low health literacy are less likely to use quality health sources. They may rely instead on social media, television, celebrity blogs, and other unreliable or questionable sources of health information. And so this, in a variety of areas, can add to public health challenges in terms of things like hesitancy to get vaccines, just as an example. And health literacy is also associated with health behaviors and a patient's role in their own care. So people with low health literacy often don't have the ability to find, understand, and use health information and services, or to be able to evaluate health information that they do come across in their environment. This can manifest itself in all kinds of ways, like poor control of chronic diseases, seeking primary care in the emergency department, just to name a few. And lastly, health literacy influences a person's health and quality of life and that of their children. So health disparities and system barriers are worse for people with low health literacy. And this can lead to more hospitalizations and higher mortality rates. And so this all kind of comes to bear in a kind of a cycle of health and of declining health and poor information. And health literacy and good design can really interrupt this and break this cycle at any point here. And so health literacy and good design can help us develop materials that people can understand. They can make complex information more simple and engaging. And they can help contribute to health equity by way of making quality information available and improving care, access to care, and clinical care itself. And so we make a big claim that design can make a massive difference in people's ability to do what they need to do to protect their health. But this is really backed up by evidence. And so some of the evidence behind good design that we like to cite and talk about is that, materials with good design are more likely to attract a viewer's attention in the first place. Well-designed materials are easier to understand and they're easier to remember. And that really gets into the adherence piece of being able to, stay with the behaviors that you need to do, whether that's check your A1C or stay on a medicine, a maintenance medicine that you're supposed to stay on. And all these really culminate in better health, informed health decisions and improved health outcomes. So here is a little quiz. Now it's your turn. I've been talking a lot. The rest of this, we hope to be a little bit more interactive. So according to one research study, when people were asked, how should you take this medicine after looking at some instructions, 47% of people who received instructions that were only text answered correctly, so less than half. So in that same experiment, the researchers showed the same instructions, but they had images and pictures to help show people how to take the medicine correctly. So what percent do you think answered that question correctly? How should you take this medicine, when they also saw the pictures? Would anyone like to take a guess? Do you think it stayed the same at 47%? Or do you think it went up? Feel free to shout out or put it in the chat. Right, people are guessing. Right, 93 people who have ventured a guess. Thank you, we love you. Have guessed 93%. So they think it just about doubled. And so that's actually correct, which is pretty great. Only including pictures, leaving the rest of the instruction the same, just about doubled people's ability to recall the correct way to take that medicine. So that's a pretty good return on investment for somebody's time to develop some nice pictures. All right, so if you're not convinced yet, here's a few more thoughts on good design and how it benefits readers and patients and people. So this is hopefully going to come a little closer to home with your work with the health department when it comes to reaching out into communities every day. So good design and health literacy principles help people read and understand print materials like fact sheets or instructions for use or discharge instructions. It can help people schedule visits and screenings easily. That can be using some kind of online portal. Design reaches over into the web, of course, and things like interface for portals and making scheduling visits and things like that. Helping people understand how to manage a chronic condition such as kidney disease or diabetes. Well-designed information can help people make decisions about risk and weighing the pros and cons. So, whether people should change, get a vaccine or try to pursue a behavior change to promote their health, or get a certain treatment. And then, as is hopefully shown in the last little quiz slide, the ability to take medicine accurately, every day at the right time, the right amount, or to give medicine to somebody else, whether that's a child or someone else that you're providing care for. So that is our kind of introduction for health literacy and design and why this all matters. What questions do you have before we carry on to the next section, which is our sort of practical tips? All right. Well, here we go. We're going to show a lot of examples because we always like to show rather than just tell. But I'll just talk quickly about kind of our process for developing materials that kind of sets the table for going into the actual, creative process. So, so step one, we want to develop clear, simple messages, hopefully with all the trainings by now. I know there's some on writing, message development. So you've got a clear idea of what it is that you want to say to people, what you want them to know, what you want them to do, the kinds of ideas and concepts that are going to motivate them to do those behaviors. So develop your message. And then next, think about how do you want to put that message out into the world? Where is the audience that you're trying to reach? More than likely that you can reach them in various ways, whether it's in a clinic with a print handout or reaching people through social media, video, different things. So there's ways to sort of hone that message depending on what, the channel that you're going to use to put it out into the world. And then we're going to work on creating meaningful visual content. So whether it's animated or sort of more two-dimensional, static, doing this yourself with a desktop or mobile app. Perhaps you're working with a vendor, a design contractor, and again, hopefully this will give some background for working with vendors and providing feedback to them that's useful. A lot of creatives have been in the place of clients saying, "Oh, I don't know, I just don't like it," which is fair enough, but it doesn't always. It can be more helpful to say, well, I don't like it because it doesn't have enough white space, or because the headings aren't bold and colorful, or things like that. So we'll talk about some of those specifics. And then lastly, you always want to test your content with other people, whether, it's if you can reach people who are directly in your target audience or your intended audience, definitely do that. But even if you don't have the capacity to do that due to time constraints or other constraints, just show it to somebody who doesn't have a whole lot of sort of experience with the same project, so it'll be kind of new to them. Just bounce it off somebody and, just make sure, okay, is this carrying forth the idea that I am hoping it will, or that I'm intending for it to? All right. So now we're going to get practical here. So tip number one, perhaps you'll remember this if you had a plain language writing training. You may remember this idea of chunking. So tip number one is break your content into chunks. Make those chunks use related information to make each individual chunk. And this does a lot for you. It helps people process information sort of one concept at a time. And so there's that sort of stair-step effect of health education of, okay, now I understand this, so I can move on to understand this next concept and this next concept, and they kind of build off of each other. But visually, they also just help break up the text into smaller sort of bite-sized pieces. I have 2 little kids, and I'm always saying, don't try to shove that whole piece of pizza in your mouth at once. Just take one bite and chew it. And it's sort of a similar thing of, don't show people sort of a big intimidating wall of words. Give them little bite-sized pieces that they can handle one at a time, and that look like they can handle them one at a time. So how do you do this? Well, as I said, we group related information together to create smaller chunks of information, but use headings to create a hierarchy and give readers an obvious path for their eyes to follow. So here in this example, we've grouped content by what to do at different points of the mask wearing process. So this is a material that we developed relatively early in the pandemic. So how to put on your mask is one section, while wearing your mask is another chunk or another section, and then removing your mask is another chunk. So you can see those headings guide readers to these main overall ideas within this example. We're going to use short line lengths. So you can see this little opening statement, surgical face masks. It doesn't go all the way across from left to right on the page. And so keep the line length to about 15 words wide on average, 20 tops. When you have long lines that go from one side or the other to the page, it can make it difficult for people to read and comprehend the text and follow from the end of one line to the beginning of the other, because it's just sort of physically so far away. And if you have a paragraph of text, the reader's eye can get kind of lost when they're in the middle. So keep those line lengths short. So using bulleted lists or numbered lists is a great practice for chunking. Each of these little bulleted items sort of stands alone as its own concept or idea. So you can just read one at a time. As a general rule, use bullets for most text, and use numbers only if the key points must be completed in a series of steps. So step 1, step 2, step 3. So in this example, we use bullets for the key points of while you're wearing your mask, because they don't happen in a particular order. But below, in the yellow, you can see we used a numbered list for how to reuse your mask, because those can, excuse me, how to remove your mask, because those obviously need to happen in a certain order. And then a last rule for chunking is, chunking is what appears on the page, but it also what doesn't appear on the page, if you want to think about it that way. And so that's what white space really is, using 20 to 35% of if it's paper, or if it's a web-based material, and you're using 20 to 35% of whatever the background is, with no text or no image on it. And that does a couple things for you. It just gives an overall impression that this resource isn't just a big intimidating wall of words that's coming at you. It gives your content some breathing room and gives it just a more relaxed, accessible look and feel for your readers, right? But white space also can be put to work to help readers see the different chunks. So you can see this last bullet here on the right side, remove and replace your mask. And then there's a little bit more space between that and the next section, which begins with remove your mask. So that white space can be used strategically to help readers see what the different chunks in a material are. And so That is the concept of chunking. Or yes, chunking. And so hopefully you've learned something about chunking. Now it's your turn again for a multiple choice question. Which of these items, if any, are true about chunking information? People perceive the material is easier to read. It makes information easier to remember. It makes information easier to process and understand. And it only works when you include white space to break up the chunks. Let's call these A, B, C, and D from left to right. Oh, we've got a response in the chat here. That's actually correct. Thank you, Diana. It's all of the above. It's a trick question. Chunking does all these things for you. Chunking is really one of the best things that you can do with help information to help readers be attracted to it and read it and understand it. So thanks for that. All right, so we're going to carry on with tip number 2, which is using easy to read text. And we're going to keep looking at the same example here. So what do we mean by easy to read text? Using a simple sans serif font. And so if you've ever read a newspaper or a novel, those use serif fonts, which is where the letters have those little feet at the bottom. They're actually called serifs. Serif fonts are great for novels and newspapers where there are large uninterrupted passages of text because it helps the viewer read those lines and not get lost within those sort of oceans of text. But since we're not making newspapers or novels, we're making health education and health information, we're going to use sans serif fonts because they show a clearer, simpler shape of the letter form, which makes them easier to read. We're also going to avoid fonts that are narrow or condensed. They're kind of squished from left to right. And we're going to avoid all those wonderful sort of display fonts or specialty fonts that you might use on your flyer for your Halloween party because they look spooky, but we're not going to use them in health information because we want it to be as easy to read for users as possible. There are many sans serif fonts available. Even if you haven't installed any special ones on your computer, even just Arial or Calibri work great, but there are other all kinds of other sans serif fonts that are available. All right, using sentence case. So that's where we capitalize only the first letter of the first word of the sentence. And so we do that because most lower literate readers recognize text by their lowercase shapes. So capitalizing the first letter of every word or using all caps can make it difficult to recognize the shape and read the word. And when you use all caps, people think you're shouting at them. Use a 12-point font as a minimum for your main sort of body text or body content. Much smaller than that, or really any smaller than that, gets really difficult for people to read, but especially for people whose eyes may have changed as they have aged, or people who have low vision. Small text with low contrast can become almost invisible. So if you're trying to reach an audience that's maybe older, consider bumping up the body text size to 13 point or even 14 point. And so with font size, also think about what platform you're creating content for. If you're creating a website or video, use 16 point as the minimum. 18 or even bigger is ideal. And that's just because people are consuming information on the web and with all kinds of different devices. And so making that text big enough if it's going to appear on a mobile device, particularly with video, is really important. And so you can see here we've used boldface or bold weight in a couple places. In the example that the arrow's pointing at, it's the phrase "a mask." Why the circumstances where you can reuse a mask. In the title, you can see the phrase "surgical face mask" is bolded, and bolding is really the best way to draw emphasis or to a certain passage of text that you want to emphasize for one reason or another. So use boldface instead of italics or underlining, because italics and underlining can change the shape of letters and make it more difficult to read. And lastly, use left justified text. Here you can see on our little example here, the text, it has sort of like a little imaginary line that follows the left edge. And that's important because it gives the viewer's eye a consistent place to kind of return to as readers go from line to line. If you're doing center justification or right justification, it makes that return point inconsistent, and it sets up a barrier for your readers, and there's no real reason to do that for them. On the other arrow here, you can see we're recommending left justification rather than full justification. This is also called ragged right. It's ragged because each line, your bag, in, your, or sanitizer, is at a different point vertically, and that's actually okay, because full justification, which is where it lines up on both the right side and the left side, it can create some weird spacing between words sometimes that can make it tough for your readers to read the sentence. So there's some ideas about text. I mean, obviously text is one of your sort of main ingredients in information. All right, your turn. True or false? Text can be too bold for people to read easily. Brian and Diana, thank you for popping in. You're our true believers. Pamela, appreciate it. It's true. As I was saying, the internet is great because you can download fonts and all kinds of fonts and use them, and it gives us a lot more flexibility, which can be really good. Unlike the olden days where you had to order a font by the mail and it would come on a little floppy disk and you'd install it on your computer. But some of the fonts can have an ultra or an extra bold or ultra bold weight, and they can look kind of cool because they are really super bold, but it actually can be too bold. So shy away from those extra or ultra bold font weights and just use if you want to draw emphasis, just use the bold weight. All right. Carrying on, using color. Color is another one of our, best sort of, raw ingredients for creating materials and media. So how do we use color thoughtfully? Think about using a limited color palette. We can, we have a rainbow of colors at our disposal, and there may be times we want to make like super duper colorful materials, but for the most part, establish a few main colors and maybe one or two accent colors. So too many colors can just be distracting. So on this, you can see there's the red and the blue and the light yellow that are kind of established by the brand. So many times you can just kind of use those brand colors and apply them through a material. And that can help sort of reinforce in a subtle way, the brand recognition. People might start to see a set of materials that your organization is putting out and get to know them and trust them. And color is one of the signals that that can suggest that. Okay, so contrast ratio, that's just a fancy way of saying, are the letters dark enough to be able to see? Or if you are having light letters on a dark background, are the letters light enough to see? In other words, is there enough of a difference between the foreground letters and the background for people to be able to easily see? There's, web-based tools that you can use to plug in your color values, and it gives you a contrast ratio. But if you don't want to use one of those, you can just try squinting. It's sort of a quick trick that you can use. Squint at it. If it disappears, you probably don't have enough contrast. So this example has dark text against a light background. And so we use either black or this dark blue, and that really ensures that there's enough contrast. Now, if we were to critique ourselves here on the right, if you plan to reuse your mask in the yellow all the way on the right side of the screen, that would probably fail a contrast check. So if you squint at that, it kind of disappears and becomes hard to read. So we would probably redo that and make that either the dark blue or probably even just the black to make sure that people can see it. Okay, so you can use colors to differentiate between different areas of content, such as that yellow section is like a learn more resource. So differentiate between different kinds of content, but also differentiate between different versions of a material. So in this example, we used sort of a bluish purple for the surgical mask and a reddish pink for a material that's about homemade masks, back when we were talking about homemade masks. And so we also use color to differentiate the headings and the bullets from the body copy and the text. And so, using color to sort of denote different types of content. And as I said, we also use color to denote or call out content and different shades or types of transparency and call out boxes, or to incorporate text but add different layers in the design, offer some variety for readers. So that's color. Next, we're going to talk about tip number 4, using meaningful visuals, again, leaning on the same example here. And so we know that meaningful visuals included alongside text make content easier to understand and more likely for your audience to remember it. And so we like to be intentional about the visuals that we use in materials. So be audience specific whenever possible, whether that's a specific population or a diverse group or a population that's often underrepresented, I can't say the word represented in materials. And so, don't just throw up sort of a generic stock art, photograph or whatever, really be intentional about it. Using visuals that are relevant to your content and really reinforce what you're trying to say, so in this example, this is step-by-step concrete instructions for how to wear a mask. So showing people rather than just telling them was really important in this example here, right? In this other example on the right, we wanted to appeal to a certain target audience. And studies show that people prefer health messages with representations of themselves, both in terms of what the people look like and in the setting or the environment that they're placed in. And so second to last here, across different projects and audiences and different uses, you may use different visual content. And so in the material on the left, we used illustrations to show behavioral specificity and help users visualize the content. We also use more illustrative characters, so illustrations, not photographs, when we do videos. For the material on the right, we used images that feature the target audience. We also used icons that are familiar and easily recognizable to give supplement to the text. Using visuals along with words, it's a proven way to show an increase in comprehension. So we often use icons in this way. And we often use icons when other visuals don't show the desired level of diversity or accessibility or inclusivity. And lastly, visual content should be up to date and high quality. You don't want to show people using an old-fashioned cell phone or something like that, because it's going to be distracting for people. So just some thoughts on visuals. And then the last tip here, number 5, including actionable and engaging content. So as much as possible, offer content that allows people to engage with the material. So what does that mean? Highlight the actions or behaviors that you want your reader to take, such as advice or instructions. You want to be as specific as possible in telling your readers what they should do, how they should do it, and why they should do it. It isn't always possible to include interactive or like clickable elements in print materials, for example. But prompting your reader to think about something, or to check a box or write a list, can all increase the chance that your viewer is going to remember. And so this is sort of the before example here on the right. We took this material and we kind of did a health literate design treatment on this. And so you can see, some of the changes here that relate to where content and design really overlap. But showing these behaviors as specific as possible, making a title that explains what this is all about, rather than just sort of a generic label, masks and hand hygiene, and so on. So yeah, that's that content. Here's some examples of those interactive elements that I was talking about. Here's some check boxes, like a schedule that somebody can fill out and use for taking their blood sugar readings. That interactivity is always great. And then lastly, when we have social media, using movement and animation is a great way to attract people's attention. So, obviously there's a lot of opportunities to use sort of dynamic content in social media channels, even if it's just offering more than one image on an Instagram post so people can swipe through and kind of interact with it in that way. Okay, and then accessibility. So kind of a bonus tip here, making materials that anyone can consume. And so we've been making a strong push to create content that's accessible. And using plain language can make content easier to understand. And using all these things we were talking about, but if someone can't perceive the messaging, then it's not very useful to them. So one of the things that we're doing is offering captions in all of the videos that we produce. And that helps users who are either hard of hearing or people who are deaf be able to consume video content, and that experience is as similar as that can be to someone who does have hearing. So captions and subtitles, using voiceover in video as well, it sort of goes the other way. So for people who appreciate being able to hear, it's processing those messages in sort of a different part of your brain, but it's also an accessibility concern. And then lastly, alt text or alternative text. This is really a web accessibility standard. So it's offering a description of an image for users who may use screen readers for a variety of reasons. So Here's an alt text description of this this image here that can help again make that experience as similar as possible to someone who is able to see. And think about the context for alt text. So you know, here's an image and some alt text that might describe it, right? Here's the same image, but imagine that this image appears in a website that's about cancer. And so, you know, the graphic here offers this, you know, image of the sort of the headscarf, the headband, or a headscarf that someone might wear if, you know, perhaps their hair loss due to receiving chemotherapy. But just thinking about the context of where this appears and what's the intent, what's the spirit of the photo, why is it there, what is it trying to convey, and making sure that your alt text reflects that. So this isn't strictly design, but it's making sure that designs are useful for all your readers. And so here's a little quiz. How much video on the internet do people watch without sound? What do we think? 32%, 80%, half, or a paltry 13%? People are saying 80, 50. It is actually 80. It's higher than you might expect. So it's just it really highlights the opportunity for using strategies in video to make sure that you can get the message across, even if someone is watching without sound because they're in a location where they don't want to have the sound going, or because their hearing is impaired. You know, that's another reason. So that's one of those things where accessibility principles really benefit everybody. They benefit all users, not just the core audience that you're trying to reach, who may have accessibility concerns. All right, so we're kind of in the home stretch here. We're coming up to the top of the hour. We're just going to quickly take a look at this free online design app that we use. It's called Canva. I'll sort of introduce it by saying there are many design platforms that are available. Some of them cost money, some are more expensive than others, but they really all allow the same core functionality, which is taking words and pictures and shapes and other visual elements and arranging them on a page or arranging them on some kind of two-dimensional, you know, plane, right? So we don't mean to say that Canva is the only or the best option. People use PowerPoint and Word all the time to do design. It'll all export to a PDF, which if you're getting something printed, that's all print shops want these days as PDFs. But we're just gonna talk about Canva. So what I'm gonna do is stop this share and start a new share. And since we are kind of coming up on time here, feel free as I do this, if you do have any questions that you've been thinking of, go ahead and ask, because I think we can do this little tutorial and kind of just have a discussion at the same time. So can everybody work with us to offer COVID-19 vaccines in your community? Are people seeing a flyer right now? Hopefully you are. Yes, thank you, Diana. And so this is just an example of a set of materials that here at HLM that we made for one of our community partners through a similar but different project of what we're working on with the Kansas City Health Department. So this is a flyer that's the sort of audience for this flyer is community organizations who this clinical group wanted to partner with to offer vaccines in the community. So they wanted to offer vaccine clinics through just neighborhood groups, community centers, and so on. So you can see the title and the subtitle really just at a glance, they say what this is about. And then we use Canva for this because this is sort of the version that the clinical group distributed to community organizations. But then we also offered this sort of public flyer version as a companion piece. The idea with this is that once a vaccine clinic or other event is actually booked and set up, that our partner could go in and they could customize this sort of template, and they could use it to type in the location of the vaccine clinic, the time, the date, where it takes place, any special, I'll zoom in here a little bit, any special instructions that there might be. They could fill in the contact information. And Canva is a great tool for this because when we create a material like this, we can distribute it as a template. And so other users can kind of click on this and it makes a copy. It automatically sort of makes a copy that they can customize and not have to worry about sort of messing up the original. And so you can see this just has some of the ingredients that we've been talking about here. It uses sort of a consistent color palette. It uses that sans serif font. It uses varies the text size to emphasize different areas. And so, making a resource like this using Canva, that's the kind of thing that we can work with partners, or, if you want to try using Canva on your own, it's really fun and it's free. So, you can do it. Canva in this little text palette, it offers some pre-designed sort of typography. So you don't have to, every time you don't have to reinvent, what these different things are. So you can see here's the heading that in some of the other materials we saw, the heading is large. It's noticeably much bigger than the rest of the text. So what is COVID-19? And then you can add some body text. COVID, and I'm just obviously making this up here as we go along. And you can just very easily scooch these little guys around on the page, and pretty easily and quickly make something that looks nice. It gives you a quick way to highlight text and apply a color. It also, any color that's been used in this document, it puts up into this little palette here. So it makes it really easy to, like I was saying before, use an established color palette. So here's the blue that was used in this. You can also copy and paste text from Word, right from an email, whatever source you might have. Canva also offers this elements box, which is really all these different visuals. And so it has little video clips and clip art and illustrations, stickers, little animated stickers if you're making something for the internet, and it's easily searchable. And here, so I've searched for vaccine. Here's some animations. Here's some photographs. Here's some clip art. It offers all kinds of great ways to add visuals to your resource that you're working on. You can even add just like little shapes and like this little text box here, to pop in if you want to sort of draw attention to something. So we love Canva, even though we do use InDesign and all the sort of paid, professional tools. We think Canva is great because it makes things easy to share. and collaborate on. So that's just sort of a quick kind of, I don't even call it a tutorial, quick introduction to Canva. So hopefully that's useful for people. And otherwise, let's get back to our slides here. And in the little bit of time we have left, hopefully, oh, Diana says, if you work for a nonprofit or a school, you can get a premium version for free of Canva. Thank you for offering that. That is true. And the premium version does offer like some of the visuals and photographs and other elements that otherwise you'd have to pay for free. So that's great. Thank you, C. Farrakhan 44. You're welcome. Any other comments or questions that people have? I know we're kind of at the top of the hour. Megan did put the survey link in the chat, so we'll hang out for a second so people can get to that survey link. Please definitely fill out there's the survey link. Please fill it out if you can spare one more minute or so. It won't take you very long. And otherwise, thanks for your attention today.